Could your chronic fatigue be genetic in nature? I'm always the truth of the matter is your genetics do play a part in how you deal with the environment, but the best geneticists in the world would say that genetics only load the gun. It is lifestyle and environment that pull the trigger. They say, look, 98 to 99% of all of your genetic expression is modified, good or bad, by lifestyle and environment, diet, things like that. So that's the subject of epigenetics. So whenever I see an article like this one on Medscape here about how genetics could play a part, or it says specifically, scientists find genes linked with chronic fatigue syndrome. When I see that, I always get a little bit concerned, especially if doctors are going to start saying it could be genetic, because that takes the control away from the patient. It actually even takes the control and the responsibility away from the doctor for trying to help fix the problem, because 98 to 99% of your genetic expression can be modified positively or negatively by lifestyle and environment. So it's sort of a cop-out, if you will. It's sort of I'm not going to be responsible for this when we say it's genetic. You can control most of your genetics. So even if you do have a genetic predisposition, even if the genetics did load the gun for you, it is what you eat, what you drink, how stressed you are, all these types of things, your toxic load, so to speak, your experiences and how you've treated your body, how much exercise you do. These are all factors that modify epigenetics, or how diet and lifestyle impact your genetic expression. It is not your genetics 98 to 99% of the time. So before you say your chronic fatigue is due to a genetic problem, and you say, well, my grandmother had chronic fatigue, my mom had chronic fatigue, X, Y, and Z, on and on, just know it's not really the case. It is how you treat your body. Now, if you want to blame it on other people, go right ahead. If your doctor's telling you you have a genetic problem, understand that he's probably trying to get out of working with treating you. I shouldn't say that. Maybe he is, maybe he isn't. But I can tell you this. Sometimes when somebody says there's genetics, they go, well, since it's genetics, there's nothing can be done about it. And doctors can be guilty of that as well. So be wary of that. I'm Dr. 𝗙𝗵𝗿𝗂𝗲 of Magnolia Medical Center here in Murfreesboro, Tennessee. Take care today.